we need to be talking to our conference officials, people further up the food chain, and really asking them. And it's going to be uncomfortable. And the sad thing is that this is a crazy polarization time we're in. So I don't know how it's going to work.
Well, one last question on that then. Should I, on the vaccine question, I could simply answer I haven't taken an mRNA vaccine. Maybe go from there. Because it's not your typical vaccine.
I agree. It's very different and far more invasive than other vaccines have been, and it works in a fundamentally different way.
Right.
I mean, you could make that argument. I mean, they call it a vaccine, but it is genetic material that will program your cells to do certain things that I'm not aware of other vaccines working that way. So
except for the rabies one.
Can I say one thing though to that, is that there is a traditional vaccine coming down the pipe, and you may not want that vaccine either. Here's the bottom line. 9 out of 10 vaccines, when they go through the testing process at the FDA, fail. They fail on either safety or efficacy. We got another vaccine that's coming through on a high-speed track. There's a study from, I think it was 2017, so before this, and basically, it wasn't even really a study, it was a paper, and the paper was basically explaining why we should never have a coronavirus vaccine at all. And the reason why they said that was they said because the proteins in coronaviruses are so similar to the ones in our body that you're going to create an autoimmune response, and these people have autoimmune disease. So just because the next vaccine is not an mRNA vaccine, don't kid yourself, we don't have anything to prove that it's safer than the ones we have. Plus, it's probably going to be full of spike protein, and even though your body won't be producing it, the spike protein is the toxin. I don't care what the vaccine is. If it hasn't gone through 5 to 10 years of actual study, the answer is no.
Well, on that one last statement, I guess in the news they came out with the FDA approval that the Pfizer vaccine wasn't technically approved. That was on the news today. It was under a different name. Their biotech or whatever the other company is the one that's approved, and it's coming out later.
So Jonathan, you may be able to speak to that better than I can. The Comirnaty is supposed to be the new name that the Pfizer vaccine was baptized with. But in fact, it may just be a cover name for a drug that doesn't exist?
I can explain it. It's an amazing thing, and FDA is being sued right now, hopefully fast enough to matter. And this is who it matters to the most, is our military, okay? Because of the rules on EUAs. But this is what they did. They said, hey, we are going to approve this vaccine, Comirnaty, and it's got the same formula, it's the same drug as Pfizer-BioNTech or whatever it is. And they said, hey, it's the same formula, everything's cool, one's approved, but then you go read the footnote. They put it in the footnote, and they say, although the formula is the same, that the Comirnaty is a legally distinct product from the Pfizer one, and that the Pfizer one will be continued to be marketed under the EUA. And in the United States, you can't get Comirnaty. They're not selling it here. So there is no approved drug available on the market today. And this is the biggest sophistry. I don't know what kind of game they're playing, but it really matters for our men in uniform because they have different rights if something is under an EUA or not.
I'll let her go and I'll
I
ask
have a
another
question, Jonathan, about that. Is there a different indemnity for the approved versus the authorized drug? Are they under a legal shield that you would not get?
So that's a very interesting question because she's saying, is there a lawsuit reason, a liability reason for this? And the answer is there could be yes, although I'm a little bit suspicious that that's not really at the bottom because just vaccines in general already have a lot of protections. And so it's true that they will have more liability, but I haven't been convinced yet that it's going to be like tremendous more, but maybe it is because we're seeing so many injuries. So it could be large. It could be the liability issue.
I just wanted to kind of clarify something about the Comirnaty. So I'm a nurse at one of the hospitals that's been put on unpaid leave because I wouldn't take the shot. And I personally have seen people being given the Comirnaty on their Mars. So I saw 2 patients last week being given the Comirnaty right
So
here.
you've seen it marketed with the
I
label on
haven't
it?
seen the actual vial, but when I look at the MAR, it was shown they were given a dose of Comirnaty
Interesting.
on the
So-
MAR.
so-
So either they're lying and they're just giving them the Pfizer and calling it Comirnaty, or they actually have Comirnaty at the hospital.
Interesting. Well, that'll be new, because I hadn't heard that it was available yet.
So I was kind of shocked when I saw it too, because that day I was looking at the MARs for some patients, and there were 2 that had been given the Comirnaty.
Okay, good to know.
So it's around here somewhere. I can't verify because I didn't actually see the vials with the labels on them, but I did see it on the MARs. So I think they have limited supplies here.